Hello everyone, I welcome you to another exciting episode of Media Voices on our various platforms. On Facebook we are Prince TV, YouTube we are Prince Media Television, TikTok we are Prince Media Television, and to our friends that are on Spotify or SoundCloud we are Prince Radio. In today's episode of Media Voices, we are going to have quite an interesting topic. To all ladies out there, come. Let's watch today's episode. We are going to take a look at the issue of Mamamakita. To all ladies out there, all mothers of the nation, when you are preparing to have your baby, your son or your daughter, among the key things you're supposed to have is a Mamamakita. This is what we call a Mamamakita. Health professionals usually advise that for you to have a safe and healthy delivery, you need to have a Mamamakita. In today's episode of Media Voices, we are joined by a doctor who is going to explain what a Mamamakita is, what are some of the components that are found within a Mamamakita, and why, as a lady, you should carry a Mamamakita. Doctor, welcome.
Well, I'm glad to be with you. My name is Kyagambiddwa Asad, Director, AJ Medical Center.
Okay. Doctor, to Ugandans out there, what is a Mamamakita?
A Mamamakita is a set of materials which are given to an expectant mother to be used during delivery or during childbirth.
A Mamamakita is used during delivery. What are some of the components that are found within a Mamamakita?
A Mamamakita has got several materials in it, and among them there is soap. Soap is very important during childbirth because it is used for cleaning. It also contains a pair of plastic sheets, or vivera, and one is for the baby, one is for the mother.
The mother,
It also contains a pair of cord ligatures. Cord ligatures which are used to tie the cord to prevent bleeding from the baby through the cord, through the blood vessels of the cord. It also contains surgical gloves. Those are used by a health professional during birth, and a health professional puts on them to prevent cross infections between a mother, a baby, and the health service provider himself. It also contains a surgical blade, a kagirita, and that one is used to cut the cord, to separate the cord from the placenta. It also contains cotton. Cotton is used during childbirth to clean around the blood which has fallen on the whole place. It also contains gauze. Yes. Gauze is used to make a pad which is put under the lady to arrest the bleeding.
The situation of the bleeding.
Yes, and it also contains some Mamakitas have got a chart, a chart which is immunization chart, and that is to record to put the records of a baby during immunization. Some of them have got a component, a very important component called ambigel. That one is used during before the cord has fallen off. So after cleaning the cord, you apply that ambigel. It contains materials which are going to kill the bacteria. Yes, to prevent the baby from getting infections. Yes. Some of them have got another important component, and that is a baby cotton sheet, a cotton sheet. And that cotton sheet is very important in that it after birth, you wrap the baby in that sheet to prevent the baby from getting hypothermia. We call it hypothermia, low temperature, because babies get complications during birth. One of the complications is hypothermia, which can lead to death. Yes. Basically, those are the components of a mama kit.
After explaining to our viewers, or our listeners, the components of a mama kit, what are some of the importances as to why mothers should carry mama kits?
Actually, the primary importance of a mama kit is preventing infections. Mothers usually get sepsis. We call it sepsis when after birth. If a mother gets infections which have entered her in the uterus or in her bloodstream, she can get sepsis or wounds which are very difficult to heal. So a mama kit is basically to prevent infections from the mother, from the baby, and from the health worker. Yes, that is the basic importance of a mama kit.
Doctor, before we conclude today's episode of Media Voices, viewers out there would want to see some of these components that are contained in a mama kit. If you can maybe briefly show us the components that are found within a mama kit, and as we close today's program of Media Voices.
Oh yeah, thank you. Like I said earlier, this is a child chart, a health card. And this is the one that we use to record, to keep the baby's records, okay? And it contains the curves which are used, which are very important in monitoring how the baby is progressing from birth up to 2 years. Yes, this is the child health card. Okay. It looks like this, and these are the two plastic sheets. One is for the baby, and one is for the mother. And this is a pair of surgical gloves. Okay, it is very important actually. If you can pursue more, you add more. Like you make like 4 to 5 pairs. Because at times you can use more than one. And this is a soap. This is the soap. This is the surgical blade that is used to cut the cord. This is cotton. Yes. And like I said, there are some mama components which are not put in some of the mama kits, but they are very important to be added. And that is the gauze, amigel, and a cotton cloth. Yes, a cotton sheet.
Thank you very much to all those that have been watching or listening to this program on our various platforms. Join us next time as we have Dr. Asad. We are casually going to be having Dr. Asad talking matters of health. Today we have been talking about the issues of a mama kit and its importance and why, ladies out there, you need to carry a mama kit. I've been your host, the Gracious Unita, on Prince Media Television and all the other platforms, Prince Radio. Join me next time as I bring you yet another exciting episode as we speak to Dr. Asad about any other new health matters. I've been your host, the Gracious Unita. Enjoy your week.